May is Skin Cancer Awareness Month, and as you just saw, your first line of defense is keeping a close eye on your own body. Today we're focusing in with Dr. Bashil Aldaba, a dermatologist with Michigan Dermatology. When it comes to skin cancer, doctor, and thanks for joining us.
My pleasure.
There are several different types of skin cancer. Can you quickly explain what those types are?
Sure. There are three major types of skin cancer. The basal cell carcinoma is the most common type of skin cancer. It can be disfiguring, but rarely kills people. Then you have the squamous cell carcinoma, which is also due to the sun, but doesn't really kill a lot of people. The one that we really have to be worried about is the melanoma. While the basal and squamous cell carcinomas can be fatal, melanoma is more often fatal than not. So that's the pigmented kind.
Okay. And you say that once a month people should do a self-exam. And what should people be looking for?
So you want to look for anything that's new, anything that's growing, bleeding, or symptomatic, meaning itching or hurting. As far as the melanoma, we'll talk about the ABCDEs of melanoma. Yes.
Okay. And, you know, for screening, and let's get perfect transition for melanoma, you say there ABCDEs kind of rules things to look for when it's melanoma.
Right. So the ABCDEs are help us to remember, are helpful in remembering what to look for. Anything that's asymmetric, that's the A. Anything that has border irregularity, so that's the B. So asymmetry, border irregularity. C is color. If you see more than one color in your mole, that may be dangerous. D is diameter. If it starts to get big, over 6 millimeters is what we consider a bigger mole. And then E is evolution. Anything that is changing. So you see a mole that's been the same forever, and then all of a sudden it's changing. You want to be concerned.
And if caught early, though, melanoma, like the basal and the other, can be treated?
Exactly. It's curable. If it's caught very early when it's localized, you have a 98% chance of survival. Once it gets into the lymph nodes, that drops to 60%, and once it's in other organs, that drops to about 17%.
Okay. Now let's talk about some of these items.
Sure.
Ways to protect ourselves, you know, from the sun. You brought with you a hat.
Yes. So before we even start, you want to avoid the sun in peak hours between 10 a.m. and 2 p.m. Once you're outside, you want a wide-brimmed hat, so that covers you everywhere, not just a cap. And then you want your sunglasses to cover your eyes, because melanoma can occur in the eyes as well, and on the retina.
Okay.
Yes. And then you want a long sleeve T-shirt if possible, that one that protects, has SPF factor in it, one that protects from the sun. If that's not possible, then you also want to do where you're not wearing any clothes, like your face, and if you're wearing shorts, you want sunscreen. I would say an SPF of 30 or above at least.
Okay, and you talked about melanoma being in the eye. How would one detect that?
Well, that's usually on eye exams, so you want to have regular eye exams as well.
And before we go, I know this year Hurley is offering some free skin cancer screenings at the CRIM.
Yes, they've been generous to have free screenings at the CRIM, so if you're worried about something, I would say see your doctor if it's urgent. If you're gonna be at the CRIM and happen to be there, you can always check us out. I will be helping them in doing that as well.
Okay, doctor, it's been a pleasure to have you in, and as summer approaches, just some very good tips to help keep us safe. Thank you so much.
Thank you. It was a pleasure.